Hi everybody, this is Eric Thorn. I'm here for Adapt Live, and bear with me, this is my first time doing something like this, so I'm going to try my best and hopefully speaking loud enough and looking right at the camera. I'm a cardiologist and an obesity medicine specialist, and I'm based in Arlington, Virginia. And today what I'd like to do is talk a little bit about my background and how I came to be practicing obesity medicine as part of my cardiology practice. And additionally, I'd like to talk about how doctors think about low carb and how you can talk to your doctor about your low carbohydrate lifestyle. So I trained in medicine about 20 years ago, and I finished my cardiology training in 2007, and my training was pretty standard. So I learned about recommending low-fat diets and exercise, but there wasn't a whole lot of education in nutrition. And for what it's worth, I didn't have a whole lot of interest in nutrition. And I think that that's not that uncommon for many physicians in training. It's not necessarily what we go into it for. So for the first part of my career, 3 or 4 years, I just recommended made the typical advice. I thought that low fat was the right way to go. I thought that managing weight was purely a matter of willpower and managing calories in versus calories out, and that's what I recommended to my patients. My experience was that people didn't have a lot of success, but my thinking at the time was it was because people weren't doing what I was saying. So in 2010, 2011, I actually had an experience that started to change this. And physicians are like most people, so oftentimes when we change our minds about something, it's because of a personal experience, not necessarily what we read in a medical journal or are taught. So it's incidentally, at that time, I wasn't paying a whole lot of attention to my own health. I'd gained weight gradually. So I'm 5'8", and I had gotten up to low 170s for my weight, and that was too much for me, but I just thought that was getting older. I didn't think that there was really anything one could do about that necessarily, or that doing something about it was more work than I wanted to put in at the time. I had kind of been ignoring my own health. My blood pressure was up a little bit. I hadn't had my cholesterol checked in ages. And I kind of put those things on the back burner, and then I had to get a life insurance exam. So that kind of forced me to face my own health. And what I found out was that my cholesterol was not good. My LDL cholesterol was high. My HDL cholesterol was in the low end of normal, certainly lower than I wanted it. My blood pressure was mildly elevated. And it forced me to start to make some changes, and it made me interested. So I started, so the first thing I did was I did what I told my patients to do. I got my FitnessPal for my phone. I started counting every single thing that went into my body, estimating the calorie counts, and I ran a calculation that said I needed to be at something like 1,500 or 1,300 calories in order to lose a pound of fat a week or something like that. And I made sure I followed the budget. And I ate low fat. Interestingly, I was finding the sugar intake to be sort of shocking, but the calories were low, so I didn't worry about it. And I lost weight. And I did that for 3 months. And I lost 30 pounds. That felt good. I was tracking my cholesterol closely at the time, and my LDL cholesterol went down. I was happy about that. But my HDL was going down too. That was a little concerning, but the LDL went down, and so I was okay. But two things were happening as I did that. So one was that I was reading a lot more about nutrition and watching some movies. I watched Food Inc. And I read books by Michael Pollan, and started thinking a lot more about how important what we eat is. Additionally, I was finding calorie counting to be absolutely miserable, and it clearly was not going to be sustainable for the next 40 or 50 years of my life. So reading Michael Pollan led me to reading about Gary Taubes. And so probably about 2.5 or 3 months into this journey, I read Good Calories, Bad Calories, which many of you are probably familiar with, which is Gary Taubes' book that really gets into detail about how essentially what I learned in medical school and was told was wrong. And it made a lot of sense to me. Additionally, given that I wasn't going to be continuing to count my calories indefinitely on an iPhone, I thought, why not give this a try and see how it works? So at that point, I started doing more experimenting, trying a low-carb approach, and then ultimately trying kind of a gluten-free paleo approach for a certain period of time. And it worked really well. I could eat whatever I wanted as long as it wasn't carbs, and I didn't have to worry about my weight. From that point on, I haven't looked back. Subsequently, my weight has gone up, but my waist circumference hasn't. Additionally, I saw an increase in my HDL cholesterol, which was somewhat shocking because I was always told in medical school that the only way to change the HDL cholesterol was to exercise a whole lot. And I did start exercising more, but it wasn't a tremendous amount. And I certainly had no belief that one could double the HDL cholesterol, which is exactly what happened. And that in and of itself was a bit of an eye-opener because, when you're told that you can't change something without medication, and yet you can, it makes you question a lot of other things that were considered conventional wisdom. So what happened from there is, when something's working for you, and then you have to start reconsidering what you're recommending to your patients as a physician. And I realized that the reason that my patients weren't having success was not that they weren't following my advice, but that the advice I've been giving them was wrong. Because I was seeing such great success, I wanted to share that with my patients. And so I started counseling patients on how they could make changes and have success. And so little by little, I started seeing success in my patients, and that was extremely gratifying. I'd always liked the idea of prevention, but didn't really know how to do it. And now I was finally having success with something that I wanted to be successful with all along. Here was the problem. Doctors are busy, and there's a lot of people who benefit from your services and need your help. And so it doesn't give you a lot of time with an individual patient to do the sort of counseling and coaching that is necessary to help people make changes. And so what was happening is I was having good success, but I was having a hard time maintaining my productivity and ability to help as many people as I wanted to help. And so it really made sense to start doing things in a more systematic way. What then changed is for the past 6 years, I've been working with a nurse, Mary Lou Hopkins, who I believe is watching this broadcast now. What Mary Lou does is she provides the lion's share of the coaching and the education to my patients, which allows me to focus on the, let's say the medical side of things. And that partnership is what has allowed me to then reach out to a lot more patients and make things efficient in order to take care of people the way we need to. So currently we practice at Virginia Hospital Center, which is an independent hospital in Northern Virginia in Arlington, right across the Potomac River from D.C. And we have a program we call the Metabolic Health and Weight Management Program. And that's important because, this isn't just about weight loss, of course. This is about overall health and reversing the metabolic diseases that, as a culture we're suffering from, and so many individuals suffer from. And our patients, while we certainly help people lose weight, we have plenty of patients who that's not the main focus. And so what we do is we work with our patients to help them. And the way I describe it is we help our patients learn how to follow a real food-based, low-carbohydrate lifestyle. And each component of that description is really important. So what we do is patients see me for an initial consultation. We review their health history, certainly reviewing cardiovascular risk factors, history of heart disease, diabetes, these sort of things. A careful review of the medication list. Medications can be very important in terms of affecting metabolism and weight. I we'll almost always do a panel of initial labs because we really want to get a baseline. And I talk to them a little bit about what they're in for. Some patients find me because they know what we do, but a lot of patients are referred by my partners, other cardiologists, by other physicians, word of mouth from friends. Our patients are very often still steeped in a lot of the traditional wisdom about the need to exercise and eat less and that fat's bad for you. And so it definitely takes some upfront buy-in for people to be comfortable with a low-carb approach. After that, our patients attend a group class, which Mary Lou does, where she really spends a considerable amount of time. These classes are about 2.5 hours or so, and that's where we really explain to people what to do. And following that, they'll follow up with Mary Lou on a regular basis for coaching. And it's really critical because our culture, as you know, it works against those of us who are trying to stick with low carb. And I think that, I'm not going to weigh in on whether sugars and carbs meet the definition of addiction or not, but I sure feel like a lot of what we do is dealing with addiction and changing habits. And that's a lot of what Mary Lou does, is work with people to overcome that. And then I see people usually back within a month and then every few months, and we follow lab work. The interval really depends on the patient, and we make adjustments and medications as need be. So that's what we do, and we model our program a lot off of what Dr. Westman does. Mary Lou spent a week in Dr. Westman's clinic back in 2012. We very gratefully commandeered a lot of Dr. Westman's materials and what he does. So he's really been a mentor to my practice and for Mary Lou. So that's us, and it's been very successful. So what I'd like to talk about is what's the role of a physician in your low-carb lifestyle, and how do you talk to your doctor about low carb? I know a lot of people have concerns and fears about this because of that traditional medical teaching, which I had talked about earlier in the broadcast. So I have a lot of patients who see me from far away because they couldn't find somebody close by, or their doctor, when they spoke with their doctor, they weren't really getting a good vibe, and they wanted somebody who could follow their blood work and make sure that things were safe without taking a knee-jerk approach to things. I guess the first question, and if you see me look down, I have a few notes here. But the first question, I think, is, should you talk to your doctor at all? And that's not. I don't necessarily think that that's a clear-cut yes answer, because the fact of the matter is if you're generally healthy and your focus is purely on prevention and maybe weight management, it's not incumbent on you to talk about your nutritional and food choices with your physician. You might find that the simplest approach is to just not bring it up, and that's certainly okay. And it's the best way to avoid a hostile response. That being said, if you're interested in knowing what your blood work's doing, and you need somebody to order it, then oftentimes it's going to necessitate that conversation unless everything comes back exactly normal. The other thing is, sometimes a doctor can be necessary for making sure that particularly your transition to a low-carb lifestyle is safe. So as you might imagine, many of my patients come to me after having developed a lot of problems, and they're on medications for metabolic diseases or other things, and certainly common is diabetes, and people can be on a lot of different medications for that, high blood pressure. And those are probably the two biggest places where having a physician supervising can be helpful, because the improvements with low carb can be so dramatic that it can necessitate reductions in those medications in order to prevent problems. The other thing is that you want to make sure that your blood work is responding in a favorable way to the changes you're making. And not everybody is the same. And so sometimes you can see changes that go the wrong direction initially, and it's nice to have somebody that can help you interpret that or make a decision about what to do. The other role for a physician is that a physician has the ability to prescribe medications. And there are a number of medications that can be very helpful for assisting people make a transition to low carb or stay on a low carb and maintain weight loss and metabolic health. In a perfect world, I think we would all be able to make changes to follow a real food, low carbohydrate lifestyle, and all of our problems would reverse. But of course, we don't live in a perfect world, and especially when you come to this point of finding low carb later in life, after you've been following some other nutritional approach and often a standard American diet for many, many years, there are long-term changes that make it then harder to reverse your problems. And so anytime somebody loses weight, there's a reduction in metabolic rate. And while that reduction in metabolic rate appears to be less pronounced with a low-carb or ketogenic approach, there still is a metabolic slowdown when you lose weight that's out of proportion to what one would expect purely based on a decrease in body mass. What that means is it is harder to maintain a certain weight when you've previously been heavier than somebody who never dealt with the weight gain or obesity in the first place. So it's very unfair. Medications for weight loss can help level that playing field. There are some medications that can help specifically with insulin resistance, such as metformin. And so these things aren't an option if you're not working with a physician. So it's something to consider. And while certainly I wouldn't advocate medications for everybody, and for the ideal situation, or for many of my patients, one of the big goals is trying to decrease the amount of medication they have to take. It can be adding medications for either short-term or long-term can be a beneficial, useful tool. So then the question is, if you decide, okay, I need to talk to my doctor about my nutritional approach, my low-carb lifestyle, then how is your doctor going to react? What can you expect? I think you can kind of break this down into maybe three categories of how your physician may react. So the first is, if you're lucky, the reaction is going to be enthusiasm. So, I think I could speak for the vast majority of physicians is that we really do want what's best for our patients, and we want our patients to do well. And so more and more, and here's the other thing, doctors are like everybody else. We are influenced by what's going on in the media, what's going on the internet, what we're hearing about and seeing around us that has nothing to do with medicine. It has nothing to do with reading journals and whatnot. And so what's happened since I've been paying more attention is that in the past 7 or 8 years, more and more low-carb concepts are becoming closer to, I'm not going to say mainstream, of course, but more accepted. People know about paleo diets. People know about low carb. The term keto is becoming heard way more frequently than ever before. And so doctors are influenced by this as well. And so what you might find is your doctor's more enthusiastic than you think. You may get lucky, and then your doctor's really enthused that you're wanting to make a change. What's probably more common is you may find that your physician has a bit of trepidation. You may even have a little bit of a mild admonishment. It's important to understand that just like my training, the vast majority of physicians and healthcare professionals are not trained in nutrition. And what happens is there's a tremendous body of medical knowledge out there, and it is not possible at all for anybody to know it all. And what that means is that the things that we're really interested in, we read more and we focus more on, and we look at a lot more critically. The things that aren't necessarily our love or our passion, we kind of go by what our mentors and teachers taught us, what we read in books, and what guidelines from the government and professional societies tell us. And we trust that what we're being told is true. But a lot of times we lose sight of the fact that what is true can change over time. The body of knowledge changes, and it's hard to stay up to date. And that's even a more acute problem in nutrition because the guidelines have been so strong for so long based on the low-fat paradigm. And so that's, even if your physician isn't necessarily anti-low carb, they've learned things a certain way. And it's hard for people to come to the idea that what they've been taught is wrong, because once they start questioning that, where does it stop? What do you stop questioning? So I think as a result, may give your physician some pause when they hear what you're doing, because it is different from what they've learned as true. And I'm going to hopefully have time to get into a little bit some other kind of myths that your doctor may be holding on to that may lead to some concern as well. But I think if your doctor's concerned or has trepidation but isn't outright hostile, then you have some room to move, to talk to your physician and to get some support. The other consideration there is that, as physicians, we follow a standard of care, and we are judged on certain metrics in terms of how we care for our patients, and that's become even a more widespread over the past, let's say, 5 or 10 years. And so the other concern that your doctor may have, even if they're not necessarily opposed to your choices, is going to be, how is it going to reflect on me if something happens to this person? If you have a heart attack and you weren't on a statin, cholesterol-lowering medication, you may know it's your choice, but your doctor may be concerned that when other physicians and his or her peers look at that won't necessarily be clear to other people in their professional community that are looking at what happens. Or even when you go see another doctor and they say, oh, Dr. So-and-so's patient's not being treated for his cholesterol, or, we're letting the blood sugar run higher than we would ordinarily. What's going on here? And I think that concern about professional judgment, both by individual peers and large organizations that are looking at how we treat our patients, that can produce some concern for your physicians as well. So just understand that can underlie some of your doctor's concerns. And I think having that understanding is important as a patient, because then one of the ways that you can help allay your doctor's concern is really just stress to your physician that you understand any potential implications of decisions you're making, and that you understand your doctor's recommendations. You're presuming your doctor's recommending something different. Let's say your doctor wants you on a cholesterol medicine and you'd rather not do it at this point in time. If you can be very explicit and clear with your physician that you understand the possible implications, and that you're making the decision with that knowledge, that's going to go a long way to making your physician more comfortable. So then there's the third potential reaction, broadly grouping these things, and that's going to be hostility. My feeling is here is where you get to the physicians who actually do care about nutrition, but have come to different conclusions about what the right approach is. There are other communities besides the low-carb and keto community that have other ideas about appropriate nutrition. Doctors will fall into other camps as well. And so there are a lot of doctors out there who feel extremely strongly that a very low-fat diet is the best approach, or a plant-based approach is best, or they want their patients to try to follow a vegetarian lifestyle. And you can probably tell if that's where your doctor's coming from, because they're going to give you much more specific recommendations on what they think you should be doing, and it's going to be different from what you're doing or what you're planning to do. And here I think that it's a lot trickier, because if somebody really feels strongly, and well-meaning, of course, but they've come to a different conclusion, they feel strongly you should be following a different sort of nutritional approach, you're probably not going to be able to convince them And that's the point at which there you're probably going to be better off looking for somebody else. That being said, I wouldn't say that's 100% of the time true. Everybody's different. And so you just got to judge that relationship. And if it's somebody who's willing to just, give you their advice, but then leave you be when you decide to do it your way, and you like the doctor otherwise, then there's no reason you can't continue to work with such a physician. But there, I think you're going to have a much tougher time. So let's talk about the physician who's a little bit nervous, but not necessarily completely anti. If that's the category that your doctor falls into, then is there any way that you can reassure your physician? I think that there's a couple of ways you can go about it. So the one approach would be to try to educate your physician. Now, here I think you're gonna find that you don't make a whole lot of headway. And I'm speaking from personal experience. I've had patients bring me a lot of stuff to read over the years, and I would love to have read it, but I would say almost 90% of the time I didn't. And that's because the number of things that I could be reading that I would like to read, that I've come up with for myself to read, is already long enough, and I'm already feeling guilty enough about the things that I haven't read that I felt like I should read based on my own conclusions, that I'm probably not going to take the time to read something that somebody brings into me unsolicited. And that's, in my opinion, most physicians. So if you are going to ask your doctor to read something, if they're showing, so first of all, you gauge if they're showing any interest, and if so, I would try to keep it minimal. I think a really good article. So what you want is something that has and in fact and also just in appearance seems medical and research based. And so bringing in a blog article or something from MedPage or something, probably not going to go a long way. On the other hand, if you can bring in like a copy of a journal article, there's a little more chance that your doc will skim it. And one of the ones that I've used, because I think it's such a good summary of kind of the state of the science for low carb, is a review article that was written by Tim Noakes and I think some colleagues, that was published in the British Journal of Sports Medicine last year. And you can Google, I think if you Google British Journal of Sports Medicine Review and Tim Noakes, you should be able to find a PDF of it. And I've used that for some of my colleagues when they ask, well, what can I look at to get a little bit more information? It's a relatively short, succinct, really well-written article. And if I was going to recommend anything to give your doctor, I think it would be that. The other thing you could try is see if you can convince them to read The Case Against Sugar by Gary Taubes, or Big Fat Surprise by Nina Teicholz. Those would be good books for your doc to read. So I think I was just talking about educating your physician. So if you're not able to get your doctor to read something, and as I said, that may be difficult, honestly, the most convincing thing is going to be to show your doctor good results. And so here, it may be a little bit of a negotiation up front, but you explain to your physician that, so this is something I really want to try. I think that if you explain that you've tried other things before, other approaches, and haven't had a lot of success, and that you feel like you need to try something different, most physicians, like anybody, would be sympathetic to that approach. Ask them to give you a time frame. If they say, well, I'm a little nervous, I'm worried what's going to, I don't know if you could stick with this, what's going to happen to your cholesterol, I'm afraid that's too much fat in your diet. Just tell them, look, I'd like to try this for 3 months, 4 months, and I'd like for you to check my lab work so we can see what's happening, not just in terms of my weight, but we can see what's happening on the inside with metabolically. So in our program, we follow cholesterol results. I don't think, many of you have probably read about or may have had your lipids checked with an advanced lipid panel where you look at much more complex markers than just the standard cholesterol. I don't think that's necessary for everybody, and I don't think that that's something you need to ask your doctor to order if it's not something that your doctor routinely does. And in fact, by asking them for the advanced lipid panel, you could, but if your doctor's a little uncomfortable to begin with, they're already not versed in low carb, so then if you ask them to order a lab test that they're not really familiar with, you might end up making your doctor more uncomfortable. But certainly a regular cholesterol panel, lipid panel, is something we follow, as well as liver function tests, kidney function. We check a hemoglobin A1C, which is a way of evaluating how blood sugar's been doing over the past 3 months. I like to check a fasting insulin level. It's in some ways it's a little bit academic, and I don't know that is going to would be a major thing that you have to have checked. I do like to check something called a high sensitivity CRP. The high sensitivity CRP is a measure of inflammation. One of the problems with weight gain, particularly so-called visceral fat and ectopic fat around the belly and the organs, is that it's inflammatory. It causes a chronic inflammation response. And that chronic inflammation is it's a risk factor with heart and vascular disease, but also can be the mediator of a lot of other ill effects that go along with the weight gain. And I think it can be very helpful to follow to assess progress. We don't do anything specifically to treat it other than work with people to make lifestyle changes, but it does go down over time, and it's a good benchmark. So talk to your doctor about checking blood work as a way of following your progress. I often find myself in the position of reassuring my patients that heart disease, atherosclerosis, plaque in the arteries doesn't develop over a period of a few weeks or months. It's something that takes place over many decades. And so it certainly can make sense to try something for a few months and see how things go in terms of the markers that we look at to determine whether somebody's at risk or not. I think that if you present yourself as in a very kind of rational-minded way and explain that it's something you want to try, that you do want the medical supervision, that you do want your doctor monitoring your labs, monitoring your blood pressure, then when you come back in a few months, and presuming you're having success and your weight's coming down, that's going to be, of course, an obvious sign that this is working for you. And then usually you'll see some kind of improvement in the blood work. And that can be very convincing to physicians. When I first started practicing with low-carb lifestyles, I was in a practice with, I think there were 10 cardiologists in the practice, and my fellow cardiologists, many of whom were older than I was, were my best referring physicians. And a lot of times people find that surprising. A cardiologist was referring patients to you to go on the Atkins diet, really? And but what it was is that these other physicians had been having the same struggles that I was, and they weren't seeing results. And I was sending patients back to them, or they were seeing my patients have success. And most physicians are pretty practical minded. So I think having that conversation will go a long way to improving your physician's comfort level. And then I think that the other thing is, if you can, if your doctor's interested in having any sort of conversation with you, which hopefully they should be, is trying to get at what their concerns are. So, I think the concerns, and I'm looking at my notes now to make sure I'm not missing anything, but I think the concerns of physicians fall into kind of 4 categories. So one of the big ones is the concern about if you're eating more fat, is that going to cause your cholesterol to go high, and is that going to result in heart disease because of the high cholesterol? And here's where the labs really help, because what happens is that the HDL cholesterol over time almost invariably goes up. Triglycerides almost invariably go down, which these are good changes. And the LDL, on average, doesn't really change. And so now if you try to say this to your doctor, they may take that as a little bit argumentative. But if you say to them again that, well, let's check my cholesterol now, and can we just give it 3 months and let's see what happens? And then we can decide what the right approach is. Then I think that can help your physician sort of get over the fear of you eating fat. Another concern that may come up is the confusion about ketosis versus ketoacidosis. My recommendation is when you talk to your doctor about following a low-carb lifestyle, that you're probably best referring to what you're doing as low carb. If you say high fat, low carb, the high fat, it may end up producing a little bit of kind of alarm bells in your doctor's minds for better or worse. And so I don't think you need to stress the high fat side of it. My general bias would be to advise you not to necessarily talk about keto or ketosis with your physician, because frankly, that's not really important for them to understand. I would just tell them I'm going to follow a very low carb or a very low carbohydrate diet approach. And if they bring up this concern over ketosis, then that would be the point at which that I would be very specific that this is nutritional ketosis, not ketoacidosis. And at that point, I think that your physician needs to educate themselves and look, if they're not willing to listen to you about something that's just proven medical fact, which is not controversial, which is that ketosis and ketoacidosis are two different things, then you may be falling into the camp of needing a different doctor again. Sometimes the concern about the kidneys comes up. So there's been this concern about too much protein causing problems for the kidneys. This is a myth. It's not something that is a concern except for maybe in the sort of very end stages of chronic kidney disease. And even then, probably the bigger concern ought to be protein malnutrition rather than too much protein. I suspect in most cases, but there's still a lot of this bias out there that a low carb diet is a high protein diet and is going to harm the kidneys. So the truth of the matter is that on a well-formulated low-carbohydrate lifestyle, you're going to eat less carbs, but you're probably not going to eat a whole lot more protein than you would otherwise be eating. And I would explain this to your physician. I would explain that, look, my plan is I'm not going to eat carbs. I'm going to eat real food, a variety of meats, eggs, cheeses, and I don't expect that I'll be eating more than I was eating before. So it's really not a high-protein diet. And so even if there is concern, it's not, what I'm doing is not going to be concerning. What I'm doing as a patient. And again, here you can bring up the labs as well. Check your kidney function to begin with and say, let's check the kidney function in a few months. And hopefully that will reassure your physician. And then the fourth thing that may come up is a lot of people have a thought in their mind that when you're doing a low carbohydrate diet, that you're just eating lots of meat, lots of eggs and bacon, and so their fear is that you're not going to get everything you need. You're not going to get enough nutrition. You're not going to be eating vegetables. And if you get a sense that this is the concern, if this comes up in your conversation, you just stress to your doctor that you're not avoiding vegetables, you're just avoiding starchy vegetables, and that you'll be eating a wide variety of other non-starchy vegetables in order to get plenty of nutrition, and that's what their conception of what you're proposing that you're going to do or what you are doing is not the reality. So then lastly, the one thing I want to talk about before we go is what if the labs go the wrong way? So what if you come back in 3 months and something's not going right? So let me save the cholesterol for last. So it's important to know the time course of changes. So what we see is that Triglycerides tend to come down pretty quickly. The liver function tests, if they're elevated, tend to improve pretty quickly. HDL cholesterol often will come up quickly, but not always. The HDL cholesterol sometimes goes down initially. I'm not sure why that happens. It probably relates to a change in the characteristics of the lipoproteins. But in any case, sometimes you see a small drop in HDL first. What I do is I always reassure my patients that if you are following the low-carb lifestyle, then we know the HDL is going to go up. It's maybe not a great analogy, but use an analogy that if you're walking down a mountain and you hit a part of the trail and it starts going up again, but you're on the trail that leads to the bottom of the mountain, well, don't worry if the trail is going up right now, because it's going to eventually get you to the bottom of the mountain. It's going down. The C-reactive protein, the measure of inflammation, that can take a long time to change. And so sometimes you start seeing a trend early on. Sometimes you don't see that start to normalize even for a couple of years. So that one is another one where if it goes up a little bit, I wouldn't get overly worried. And then the LDL cholesterol, the so-called bad cholesterol, that's the one that is always problematic. So my general gestalt is that even though on average the LDL doesn't change, we probably see it go down in about 40% of the time, maybe a little bit less, and maybe 15 or 20% of the time it goes up. And if it's a small change, that might just be noise, just maybe a little bit of statistical noise. And if it's not a huge increase, you talk to your doctor about saying, let's wait a little bit longer and let's check it again and see what happens. On the other hand, sometimes it goes way up. So some people are what have been termed hyper-responders, and you see increases in both the HDL and the LDL cholesterol, and sometimes the LDL cholesterol rise could be quite dramatic. And so the question is, what do you do then? And frankly, I'm not really sure what the right answer is in terms of treatment. There's just a lot we don't know about cardiovascular risk in folks who are following a real food-based, low-carbohydrate lifestyle. If that happens, then your physician's probably going to want you to change course, and they're probably going to want you to start a statin. And so you got a couple of options here. One is that, especially if you really are concerned about your risk, if your blood pressure's still up, if you have a strong family history of heart disease, then taking a statin might be the best approach, because it can give you the best of both worlds. And I know this can be controversial in the low-carb community, but if a low-carb lifestyle allows you to have optimal blood sugar, optimal HDL and triglycerides, fixes your fatty liver, helps you lose weight, and you feel great, and there's one negative health marker, which is the LDL going up, but you have reason to be concerned about your cardiovascular risk, then you could take a statin, and that will lower the LDL cholesterol and will likely reduce your risk for cardiovascular events, and you could still reap the benefits of low carb. On the other hand, you could look at that and say, well, look, everything else went the right direction, and if we really look at the overall risk, even with the LDL going up, even if that doubled my risk for heart disease, because I've reduced my overall risk so much, that doubling of risk may not matter that much. And so particularly if you're younger, if you don't have a strong family history of heart disease, then this, I think, is a pretty good argument. And so you may have some success convincing your physician of that, or at least convincing them enough that they're comfortable with you making your own decision. I recently had a discussion with one of my colleagues of a patient whose LDL is very, very high, and we ran. There's these risk calculators that you can plug in the patient's characteristics, and it'll spit out a percent risk for heart disease in 10 years. And he was convinced that the risk would have to be over 10%, but everything else had gotten better for this particular patient. We plugged the numbers in, and her LDL was high. I think it was like 200 or over 200. And we plugged in those numbers. The risk came out to less than 1%. And it just goes to show that we can't just look at one number. And so that can be, I think, a good argument to make. And certainly it's an argument I've made for my patients who are not necessarily convinced that low carb is the right way to go, but they're having good success, is to say to them, look, guys, everything's getting better. This is just one number. Let's just kind of wait and see how things go. And then lastly, there's this is a place we're doing further testing, like the advanced lipids, to look for the number of LDL particles or the size of the particles can be helpful. Although, I'll be honest, in most of my patients whose LDL goes up, the number of particles usually is going up also. And so that doesn't always mitigate the assessment of risk. And then the other thing to do is you can get a calcium score. The calcium score is a type of CAT scan. It doesn't it doesn't require any contrast agents. It does use a little bit of radiation, but it's a very low dose. And what the calcium score does is it looks for calcium in your coronary arteries. And because plaque, as it matures, has calcium deposits associated with it, the amount of calcium correlates with the amount of plaque that's present in the arteries. So if you get a calcium score and the calcium score is 0, then you have a pretty good argument that your risk is low. And so that just because the LDL is high, you don't need medication. On the other hand, if that calcium score is high, and the way we grade these things is anything up to 100 is considered generally low risk, 100 to 400 we moderate, and above 400 is high risk. If you do that score and it comes back at 500, for instance, then going on a statin probably makes good sense because now you know that your overall risk, even with your lifestyle change, is increased for cardiovascular disease. And so at that point, it very well may be, it probably is worth taking a statin to help mitigate that risk. So the calcium score may change your point of view as to whether you would want to be on a medication, not just your doctor's. It gets a little bit tricky with the calcium scoring, though, because calcium takes time to deposit. And so if you're young, certainly if you're less than 40 years old, the calcium score is not that useful because you could have so-called soft plaque that doesn't have calcium yet, and the calcium score would come back 0. And so that doesn't really help you in determining your risk more long-term. Alternatively, if you're older in particular, your calcium score being elevated, well, that may just reflect what's come before. Sometimes we get these calcium scores that are more in that intermediate range between 1 and 100, and then it's not always the best help at making a decision. But, it's a starting point, or more than a starting point, it's just more information to determine what to do, and it does have the potential to push you one way or the other. Somebody just commented, can calcium scores be reversed? And that's a common question, and the answer is, I'm not sure. There's not a lot of great data on this, and there's certainly no large series showing reversal of calcium. The way I counsel my patients is that it's possible that it may be able to be reversed. We don't know for sure. But as long as the plaque doesn't get worse, and as long as you don't have a heart attack, it doesn't really matter. And so whatever your calcium score is, if you die at age 95 with that exact same calcium score and it never reversed, well, that's okay. We did our job, you got where you wanted to go. So I don't really know, and hopefully we'll have the answer to that question at some point, but not right now. And then, of course, part of the problem with looking at any of the medical literature is that you have to assume that most of the patients were on a pretty standard diet. And so to what degree does anything apply to those of us following a real food-based, low-carbohydrate lifestyle? And we don't know. So I'm going to leave it there. I apologize and I apologize to the Adapt All team for my battery going dead. Hopefully you'll forgive me. And maybe you can put these two videos spliced together. I don't know. But this has been a real pleasure. I really enjoyed the opportunity. I hope this was useful and helpful to people. And I'm gonna end by first of all, so one of the questions that comes up is, if my doctor's not supportive, how do I find a low-carb doctor? And there's a few lists online, and I'm going to highlight the 3 that I know about. So one is Jimmy Morse, Live and La Vida low-carb site. Well, he has a list of low-carb doctors. The address is lowcarbdoctors.blogspot.com. I've had a lot of patients find me from there. There is also a list on Low Carb USA. So if you go to www.lowcarbusa.org, and then there's a link for providers. you can find a lot of low-carb practitioners on that site as well. And then there's also a site called foodmed.net. That's foodmed, FOODMED.net. And there's a low-carb map of the world. And so particularly for those of you outside the United States, this may be more useful. And then I'd also like to encourage all of you who haven't already, please subscribe to the Adapt Live Facebook site, and then you'll be made notified of future videos. So thank you, Glenn. Thank you to Adapt Live, and this has been a real pleasure. And I'm going to sign off now. Bye.